Lower back pain is a common condition that refers to pain or discomfort in the area of the lower back, which is located between the rib cage and the hips. The lower back is made up of several structures, including the vertebrae, muscles, ligaments, and nerves. Lower back pain can be acute or chronic, and it can vary in severity and duration. Acute lower back pain is usually a sudden onset of pain that typically lasts for a few days to a few weeks. Chronic lower back pain, on the other hand, persists for more than 3 months and may be caused by an underlying medical condition. Common causes of lower back pain include poor posture. Sitting or standing for long periods of time with poor posture can lead to lower back pain. Strain or injury. Overuse or sudden injury to the muscles, ligaments, and discs that support the lower back can cause pain. Degenerative conditions. Age-related wear and tear on the spine can cause conditions like arthritis, spinal stenosis, and herniated discs, which can lead to lower back pain. Pregnancy. The additional weight and hormonal changes of pregnancy can put extra strain on the lower back. Sciatica, compression or irritation of the sciatic nerve, which runs from the lower back down the leg, can cause pain in the lower back and leg. Osteoporosis. Loss of bone density can cause the vertebrae in the spine to become brittle and prone to fractures, which can cause lower back pain. Medical conditions. Certain medical conditions such as kidney infections, bladder infections, and fibromyalgia can cause lower back pain. Psychological factors. Stress, anxiety, and depression can cause or exacerbate lower back pain. There are several techniques that can help alleviate lower back pain. Here are some of the most successful techniques. Exercise. Regular exercise, particularly strengthening exercises for the lower back and core muscles, can help prevent and alleviate lower back pain. Low-impact activities such as walking, swimming, and cycling can also help. There are also several exercises that can be effective for relieving lower back pain. However, it is important to note that the best exercises for lower back pain will depend on the underlying cause of the pain, and it is recommended to consult with a healthcare professional or physical therapist to determine the most appropriate exercises for your specific condition. Here are a few exercises that may be helpful. Cat-cow stretch. Get on your hands and knees and alternate between arching your back up, like a cat, and dropping your belly down, like a cow. Bird dog. Get on your hands and knees, extend one arm and the opposite leg, and hold for a few seconds before switching to the other side. Pelvic tilt. Lie on your back with your knees bent and your feet flat on the floor. Tighten your abdominal muscles and press your lower back into the floor. Wall sit. Stand with your back against a wall and slide down until your knees are bent at a 90-degree angle. Hold for a few seconds before standing back up. Bridge. Lie on your back with your knees bent and your feet flat on the floor. Lift your hips up toward the ceiling, hold for a few seconds, and then lower back down. Remember to start slowly and gradually increase the intensity and duration of your exercises. And again, it is always best to consult with a healthcare professional before starting any new exercise program, especially if you have any pre-existing medical conditions or injuries. Heat and cold therapy. Applying heat or cold to the affected area can help relieve pain and inflammation. Heat therapy, such as a warm bath or heating pad, can help relax muscles and improve blood flow. Cold therapy, such as an ice pack or cold compress, can help reduce inflammation and numb the pain. The application of heat and cold can be used for a wide range of conditions, including muscle strains, joint pain, headaches, and arthritis. Here are some tips on how to apply heat and cold therapy. Heat therapy. Use heat therapy for chronic conditions or injuries that have been present for a long time. Apply heat using a heating pad, hot water bottle, or warm towel. Wrap the heat source in a towel before placing it on your skin to avoid burns. Apply heat for 15-20 minutes at a time, up to 3 times a day. Cold therapy. Use cold therapy for acute injuries or conditions that cause inflammation or swelling. Apply cold using an ice pack, a bag of frozen vegetables, or a cold gel pack. Wrap the cold source in a towel before placing it on your skin to avoid frostbite. Apply cold for 10-15 minutes at a time, up to 3 times a day. Alternating heat and cold therapy. Use alternating heat and cold therapy for conditions that require both pain relief and inflammation reduction. Apply heat for 15-20 minutes, then apply cold for 10-15 minutes. Repeat the cycle 2-3 times, ending with cold therapy. Targeted massage therapy. If you're experiencing lower back pain, a targeted massage can help alleviate your discomfort. A skilled massage therapist can use a variety of techniques to address the specific muscles and structures that may be contributing to your pain. They may use deep tissue massage to release tension and adhesions in the muscles, trigger point therapy to address specific points of pain and tenderness, and myofascial release to address the connective tissue that surrounds and supports the muscles. By targeting these areas with skilled massage techniques, your therapist can help to increase circulation, reduce inflammation, and promote healing, leaving you feeling more relaxed and pain-free. Here are a few stretches that can help relieve lower back pain. Kneaded chest stretch. Lie on your back with your knees bent and feet flat on the floor. Bring one knee up to your chest and hold onto it with both hands. Hold for 15-30 seconds, then switch legs. Cat-cow stretch. Start on your hands and knees with your hands directly under your shoulders and your knees under your hips. Inhale and arch your back, bringing your tailbone and head towards the ceiling. Exhale and round your spine, bringing your chin to your chest and tailbone towards the floor. Repeat 5-10 times. Child's pose. Start on your hands and knees, then bring your hips back towards your heels and stretch your arms forward. Relax your head and neck and hold for 30 seconds to 1 minute. Cobra pose. Lie on your stomach with your hands under your shoulders. Press your hands into the floor and lift your chest, keeping your shoulders away from your ears. Hold for 15-30 seconds. Standing hamstring stretch. Stand with your feet hip-width apart and hinge forward at your hips, keeping your back straight. Reach your hands towards your toes or ankles and hold for 15-30 seconds. Poor posture can often be a contributing factor. Here are some tips for improving your posture and reducing lower back pain. Sit up straight. When sitting, make sure your back is straight and your shoulders are relaxed. Keep your feet flat on the ground and avoid crossing your legs. Use a lumbar support. If you sit for long periods, use a lumbar support cushion or a rolled-up towel to support the natural curve of your lower back. Adjust your chair. Make sure your chair is adjusted to the right height so your feet are flat on the ground and your knees are at a 90-degree angle. Adjust the armrests so your shoulders are relaxed. Take breaks. If you sit for long periods, take breaks every 30-60 minutes to stand up, stretch, and move around. Strengthen your core. Strengthening your core muscles can help support your lower back and improve your posture. Exercises such as planks, bridges, and pelvic tilts can be helpful. Use good posture when standing. Stand with your feet shoulder-width apart and distribute your weight evenly on both feet. Keep your shoulders relaxed and avoid slouching or leaning to one side. Sleep in a supportive position. When sleeping, use a supportive mattress and pillow to help maintain good posture. Avoid sleeping on your stomach, as this can strain your lower back.